Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to healthcare. This week we hear from Evonnia Woods. She's the senior outreach producer for Reproaction, an advocacy organization focusing on reproductive justice. She spoke about how the lack of knowledge about our own bodies can lead to unintentional pregnancies and sometimes poorer outcomes. Here's Evonnia.
So a lot of the times, the health of the parent is indicative of a lot of issues we have in our healthcare system. And then it can have a bearing on the health of the child up to a year, right? That's by definition infant mortality, but our healthcare system doesn't support that, where a lot of the care drops off at 6 weeks after the child is born for the parent and the child, if you're relying on Medicaid. So you end up with that as a barrier. Barriers are also racist physicians or healthcare professionals, and the way that poverty ties into that, and being able to afford to get the care that you need when you need it and where you need it and have access to that. There's so many barriers. I could list them all day, but a barrier that I don't think, I'm going to mention this one because I don't think that it gets enough airtime, and that's we really don't know enough about our bodies. We don't know enough about our reproductive systems. And with that said, a lot of people don't even start learning until they get pregnant, right? And so they don't know that what's happening, if it's weird, if it should be happening, if it shouldn't be happening, what to look for. So they're being educated about it as they're going through it. And that one for me, despite I've been doing this long enough where I should know just how ignorant we are about our bodies, but it still catches me off guard. It still catches me off guard just how little we know about our reproductive systems, how we get pregnant, the stages of pregnancy, different ways to give birth. There's so many people who don't know what a doula is, don't know what a midwife is, think that you can only have babies in hospitals, or that it's just oh yeah, I may get sick the first trimester, or oh yeah, I may have heard about diabetes while you're pregnant, or your feet swelling. It's a lot of hearsay, and it's we pick up on pieces, but then that goes back to comprehensive sex ed and how all of these things intersect. So when you're not getting comprehensive sex ed, you end up with a large amount of the population not knowing much about their reproductive systems, how they operate, how they function, how they work. There's so many myths on how you get pregnant, when you can get pregnant, right? And so people end up getting pregnant who don't intend to. In some cases, people don't even realize that they're pregnant, right? Some of this does come from us not knowing how our reproductive systems work, how pregnancy works, how giving birth works. So it can definitely add to the trauma. It can add to health outcomes that are unfavorable.
That was Evonnia Woods with Reproaction, speaking about how barriers, like a lack of comprehensive sexual education, can contribute to poorer outcomes for moms and babies. That's it for this week's Missouri Health Talks, which was reported and produced by Rachel Schnelly. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.